My name is Craig Gordon. I represent the N.E.A.D Foundation, N.E.A.D.USA.org. N.E.A.D stands for Nutrition and Exercise versus Addiction and Disease. Today I'd like to talk about a topic that a Dr. Max Schneider, a Harvard-trained MD, would refer to as his speak on death in recovery. So Dr. Max I met and heard this presentation 25 years ago in the Hollywood Sheraton Hotel where we had a convention. And he was talking about how cigarettes were the leading cause of death in recovery. And boy, that intrigued me because I have always had a big problem with cigarettes. So what he was talking about was how you use your lungs as a delivery system into your blood faster than a needle, like good old crack. So this diabolically efficient delivery system puts the 599 some odd chemicals in your blood faster than a needle. So it turns out that I have actually read the list of chemicals that includes horrid stuff like acetate, formaldehyde, a whole long list and variety of chemicals that you could neither enunciate or identify. But what was very interesting was the 30 types of alcohols, sweeteners, and syrups. A boatload of sugar. And so 15 years ago, it kind of just flew off my tongue. Instead of calling cigarettes, tobacco products, I call them sugarettes. So the 30 types of alcohol, sweeteners, and syrups mask the flavor of the barn floor, make cigarette consumption somewhat palatable, but we all think of cigarettes as nicotine. Well, I don't think the nicotine is as powerful or deleterious to someone's health as all that sugar. Then we roast it up to 1800 degrees, and it goes into your blood like a missile. And how many people smoke cigarettes in recovery? An awful lot. So typically we get into 12-step programs if we're lucky. And those 12-step programs say don't drink and drug and go to meetings. And work your steps and work your traditions. And also frequently it's don't worry about the cigarettes, don't worry about the sugar, don't worry about the coffee. We'll attend to that some other time. Just don't drink and drug and go to meetings. And so people are smoking a ridiculous amount of cigarettes. Now it's vaping. Sometimes it's chew. And what are they doing? They're putting a huge load of sugar in their system, again through their lungs. Diabolically efficient. So this is what I believe to be, and Dr. Max believed to be, the leading cause of relapse and death in recovery. So supposing your body is an entity and it needs fuel and it needs nurturing, it needs attention, it needs maintenance. And you're smoking and you're in recovery. So you've already been through a pretty vicious beating with your drugs of choice, and now you pick up double or triple your cigarettes, coffee, and sugar, particularly your cigarettes. We are in a lot of trouble. And until we get the cigarettes and the vaping and the chew products out of our system in recovery, we are going to remain in a lot of trouble, and recidivism and relapse and early death are going to be very difficult on us. My friend Joan, who passed recently, would say to me, there is no difference in the suicide rates between somebody in a typical recovery program and one that just keeps doing whatever they're doing. No difference. So our bodies remain sick, malnourished, blood sugar disordered, and in a very poor condition, and our brains follow our body like a perfect shadow. So what do you think? My name is Craig Gordon, N.E.A.D Foundation, NEADUSA.org. Please subscribe if you like what I'm talking about and talk me up. Take care of your body. Good luck. Thank you.